Tylenol.
We're going to break down what you think parents out there ought to know.
During pregnancy can be associated with a very increased risk of autism.
When we take Tylenol, we're suppressing the immune response.
The meteoric rise in autism is among the most alarming public health developments in history.
What do we know about Tylenol and it being linked to autism?
Since 2000, autism rates have surged by much more than 400%.
We promise transparency as we uncover the potential causes and treatments, and we will notify the public regularly of our progress.
This press conference about Tylenol and autism in the Oval Office, President Trump, RFK, captivating the nation. We're going to break down what you think parents out there ought to know.
Absolutely, and this was captivating, I think, for the nation, and it's taken social media by storm, with everybody either supporting or antagonistic to President Trump and his HHS Secretary's recommendations. So let's unpack this.
You're Dr. Ron Dummar. This is the Be Well Now podcast. I'm a patient of yours and co-host of the Be Well Now podcast. If you like the ambiance of this room, let us know. Write in the comments below. We changed up the room. We changed up the microphone setup, trying to deliver kind of a more homey kind of fireplace vibe. But anyway, what do you think I should know as a parent about Tylenol, about autism? For some people, this is like the first time they're learning about this stuff. On the Be Well Now podcast, we talk about issues like this all the time.
Yeah, so an antipyretic medication is what we're talking about here, right?
What does that mean?
Antipyretic essentially means a fever-reducing medication. So let's look at when we would usually be using Tylenol. People use Tylenol oftentimes just for aches and pains. They'll use it for cramps. They'll use it for a variety of different things. But really, the intentional use for Tylenol is as an antipyretic, as a fever-reducing medication.
Right.
It's a very frequent use of it. So you think about those times when your child may be getting a fever or having an elevated fever, what you think is an elevated fever. When should you be using Tylenol? That's a good question to ask as a parent, right? And now that we have received this instruction, you could say, or at least this information from the Health and Human Services Committee, we might want to take a step back and say, whoa, is this really the best thing to be giving our kids? Or maybe should we be waiting and observing before we actually implement the utilization of Tylenol?
Because I know firsthand, I don't know if it's a mom thing or whatever, but my kids, when they're over at their mom's, say, when they have a fever, when they're sick, mom gives them Tylenol.
Yeah, right away.
And I was
and we're
chastised.
talking about like 101 degrees too.
I was chastised for not having Tylenol in my place, but I was like, usually this pain will pass and we'll get through it, But I don't want to seem inhumane. So like, parents want to take their kids' pain away. Doesn't mean they're a bad parent if they give them Tylenol, right? But we just want to know, how do we steward our kids' health as best we can?
Sure, and one of the fears that a lot of parents actually have, and I think it's propagated, at least in part, through pediatrics, right, is this fear of their child having a seizure or developing some sort of brain damage as a result of a fever. And there was a study actually recently done, and it surveyed 15 separate individual studies that were done on fevers and the potential of developing brain injury due to fevers. And what they found is that there is no relationship between the high fever and brain injury. Okay? So they said all the way up to even 105.8 degrees. So obviously we're not suggesting you do that with your child, but they had incidences within the studies at up to 105 degrees, and there were still no incidents of brain injury. In fact, what it did, it actually protected the body, the immune system. It ramped up the immune system and helped the body and the patient to clear off diseases. And so one of the mentions in here as well, one of the physicians actually mentions that the body's natural ability or natural response to an infectious invasion is to have a fever. And so maybe we should allow that or observe that before we try to suppress it. And Tylenol being one of the ways that we would suppress it. And if we suppress it, are we actually just keeping the pathogen in some sort of subset within the body? Are we just keeping it where it's waiting and waiting and waiting until another later date and it can manifest?
It's so wild because I know we've talked about doing a fever podcast, but you have to be real careful with what you say. But then on the national stage, this doctor's like, actually, the fever is what fights off the infection.
Yeah, we've talked about that a lot.
So you say whatever you want to or not, but I feel like if he's saying it, it gives you an opportunity to be like, well, they're talking about Tylenol and they're talking about autism. Why do we take Tylenol? It's when people have fevers. So if the national discussion is about something that could help with a fever, I think it's the topic of discussion.
Absolutely. Well, and it's interesting if we kick off this press briefing, who starts it off? Of course, the man himself.
And he's like,
President
just don't
Trump.
take Tylenol, basically.
Yeah. And what does he even say? He's like, well, no, Bobby, he has to be really careful with his words, but I'm not careful at all. I'm just going to tell you not to take it, right? I'm just going to say, don't take it. Don't take this stuff. So I think it's important to also look at the literature and really understand what is being said, what's being said by the professionals at HHS, not just the flair and the pomp and the political nature of what President Trump said, but what's being said by his advisors. And what's being said by them is, this is one of the potential relationships or a potential underlying causative factor that we've begun to study. And among many, like RFK said, there's many potential underlying factors. Not
as it
just
relates to autism?
As it relates to autism as a causative factor for autism.
So what do we know about Tylenol and it being linked to autism?
Well, what the studies are suggesting really is that mothers who are taking Tylenol in pregnancy, during pregnancy, they're taking it to suppress a fever or they're taking it regularly for aches or pains, that they tend to have a higher association or a higher correlation of essentially having offspring that develop autism spectrum disorder. So that is there. Now, the relationship you can't say is exactly causal at this point. So they're saying there's a correlation, which means that if there's a correlation, the curve, they both rise at the same time. That's the correlation, right? Both of them go up at the same time. And that doesn't really mean that it's causative at this point. So we have to dig down, and that's what the advisors are saying as well, is this really causing it, or is it just correlating? Now, there's a lot of things that were mentioned there in that press briefing as well that could also be causative, but that happen to correlate. Well, we have a correlation of an increasing toxic soup of an environment that we live in, right? We have exposure to plastics, we have exposure to toxins of all sorts, we have exposures to pesticides, herbicides, right? We have exposures to all of these type of things, and poor quality diet, poor quality GI, right? Low metabolic health, right? So all of these things actually play a role into our neurological or neurodevelopment system. One of the things that Tylenol does do that we need to understand, which is actually biochemical in nature, is it decreases our body's ability to detoxify and eliminate certain pathogenic factors.
How?
So it works through the liver. It has an effect on the liver. So just like you hear, a lot of patients have heard a lot over the past few years, and they've come into my clinic as well and been like, oh, I don't want to take the ibuprofen. I know that's hard on my kidneys. That's hard on my kidneys. I'm like, okay, great. There's some education is getting out there on the effect. Now, those can still be utilized or recommended in small subsets where it's necessary or needed for short duration or short periods of time. As long as it's not high doses over long periods of time, for sure, it works that way. But when you look at what Tylenol does, it actually affects the liver. So it's not necessarily affecting the kidneys like these others do, but it's affecting the liver more specifically. Liver is our major detoxification organ. So there's a detoxification pathway called CYP450, and it interferes with that. And that is like one of our major detoxification pathways within the liver. Another thing that it interferes with is our ability really to properly utilize or folate, so B vitamins within the body. And there's an enzyme called MTHFR, or methyl tetrahydrofolate reductase. Okay, that's a mouthful just to get out, right?
Yeah.
So MTHFR If you actually have this genetic variation, which about 40% of the US population has, it means you're susceptible to not being able to properly utilize certain forms of B vitamin. And then that would make you more susceptible to damage having taken or utilizing Tylenol, especially at higher doses. So then at this point, so the connection here, right? Because I just told you a bunch of stuff about the liver.
Yeah.
But the connection is, okay, now I'm not detoxifying as well. Now I have an exposure. Then it allows that exposure or that pathogenic factor to rise and create more of an inflammatory reaction. The inflammation becomes more central to the neurological system. And then I develop more pathogenic developmental issues because of the inflammation and the lack of support nutritionally as well in the neurological system.
So, there's a political response to all this. What do you make of it all?
Well, actually, that's a good question that you bring up, because there is a political nature to everything that a politician says. And with dealing with medicine and politics, it's really dicey, because you have people who are committed to or the antithesis to a certain individual. So anything that that individual chooses to say, they want to prove otherwise. And sadly, I don't think it's a really wise idea, and I don't know why that they would make themselves the sacrificial lambs, you could say, but there's a group of people that are proving or showing and demonstrating by their own experimentation with themselves when they're pregnant that Tylenol apparently is safe. And so they're taking copious amounts, or they're trying to take large doses of Tylenol during pregnancy, which I really don't think anybody recommends. In fact, there was a I think it was a tweet that was sent out by Tylenol, the Tylenol company themselves, and just said, we don't recommend any of our products to be taken during pregnancy.
Really?
Yes, and if you will look at this, we'll find this tweet and see if we can post it out there as well. But it's I think it was in 2017 is when it was posted, and but you look at that and you say, okay, let's look at things outside of the political realm, and let's step back and just breathe for a moment and say, can we get some clarity on what is actually occurring, what we see developing, what we see happening, and what potential causative factors there could be to autism. And is it possible that Tylenol could play a role there? It's possible.
It sure is. So RFK goes up and starts talking. Again, RFK and Trump, I mean, to some people they're the saviors, other people the Antichrist, you know. What do you make of his words at this news conference? Anything you think worth taking home?
Well, I think I'm a big fan of RFK, and I think RFK is very measured in his approach and in his responses, and he's really detailing and laying out, this is what we're aiming to do. This is what our objectives are. And he states himself that he believes there are many potential underlying causative factors of autism, and that Tylenol simply, through some of these studies, there was a Harvard study that they cite, right? But through some of these studies, there's correlation. They're saying, look, we have evidence, scientific evidence that shows correlation between Tylenol use and autism spectrum disorder development.
Now, is that with women who take it during pregnancy or anybody?
It's both, but is specific in that study was women who take it during pregnancy.
Got it.
Okay, and if you look at the correlation, it is more specific to the women who take it during pregnancy. But if you're giving it to a young child, and their neurodevelopment system, there's still, you're not neurologically fully developed. I mean, it takes a while. I would say minimum 10 years of life, right? And there's at one point, President Trump actually recommends, he says, well, I wouldn't even give patients X, and I think he was talking about a vaccine at this time, because he kind of weaves back and forth between Tylenol and the vaccines, and we can talk about, you know, my theory about what he's thinking in his brain and why he's doing that. But I think that ultimately the reason he's weaving back and forth is because he's looking at that and saying, okay, we shouldn't take this until about 12 years old because there's neurological development, there's immunological development as well. And we're still developing even our immune responses until somewhere around 10 years old or more.
I remember when I was talking to the doctor, I was like, can we just delay putting all these vaccines into my kid? And I'm not a scientist, but it was just like, surely if I can't leave this room without you looking at me like, I'm going to abuse my child if I don't just get all the vaccines at once. Surely we can have a discussion around maybe we don't do them all at once and we stagger them. And even then I felt like I just got these weird looks, and it was like, that's the best I felt like I could do.
Well, what happens is more often than not, your children get treated as policies and not as people. And that's the problem. And that's what we're trying to discover. I see what they're doing, what RFKJ is doing with his team, is instead of having so many policies and treating children as policies, we want to treat children as people and understand people and what affects people and what could be potential causative factors in people's lives, and listen to people, listen to them as subjects of individuals who have actually experienced this, right? There were two mothers that they brought in this press conference as well, and they shared some of their experience. One was a high-functioning autism spectrum disorder individual, and the other one was a mother of a low-functioning autistic individual. And they shared kind of their experiences, and they were grateful. They said how grateful they were, ultimately, that something was even being done, right? Just the fact that they're saying, we're looking into this because we think it's a significant issue. Yeah. That alone, I think, is a win. It's a big win.
Let's talk about folate deficiency. I don't know what that means. You wanted to talk about it because you think a parent out there ought to know about this.
Yeah, well, so folate, and we mentioned this more around the MTHFR. So this is related to the methyl tetrahydrofolate reductase enzyme. So that's the MTHFR, and this is a specific SNP that can be found within your genetics. So some patients or some people are saying, physicians, well, there's a genetic component to this. Okay, there may be a genetic component to it. We don't entirely know, but certainly your genes make proteins. They signal the making of proteins, which are instruction molecules. They tell your body how to respond to certain things, right? So if you're missing a certain SNP or a certain section or enzyme, then it's actually going to make it harder for your body to utilize B vitamins, especially certain synthetic B vitamins like folic acid. Folic acid has actually been shown to be toxic in these patients. So they have to have what is called folate. These individuals they have to have methylated folate that are missing, or that they have this SNP, which is MTHFR. They have the SNP on that gene that makes it difficult for them to process and utilize those B vitamins. So you do need specific B vitamins, and this is where they talked about, one of the doctors brought up leucovorin. Leucovorin is actually a medication. It's a synthetic B vitamin. That's what it is. They synthesized this B vitamin, but what they found was, now if you have a patient, or if you have or know somebody who has ADHD or autism, it's very likely, and you're going to want to explore the use of methylated B vitamins with them because it improves neuronal function and activity. And this medication, leucovorin, had shown in certain studies a high rate of success with patients improving in cognition, in their ability to have attention and focus. And so they're looking at utilizing or recommending the utilization of leucovorin in patients that are on the spectrum. So what leucovorin does, which is pretty interesting, because what will happen when certain patients who have that defect that we talked about, when they get a B vitamin, especially if it's a different type of, like a folic acid, a different type of a synthetic vitamin, it will get kind of stuck and won't be able to work within the pathways that it needs to activate the brain and have proper neurological function. But this leucovorin, it actually moves into all different pathways within the neurological system and can light up and activate them all, so that the patients ultimately have better neuronal activity.
So you support looking into this more?
Oh, absolutely. I mean, as a medication, I still think because it's synthetic, we have to be cautious and watch, right? We have to watch it. But if you want to try it, ultimately, at this point, what they're saying is this is an option. And when has anybody in the general public even heard of leucovorin as a potential option to give some of these parents respite from all the dysfunction that is occurring within their child? If you've been around an autistic child, either a high-functioning or a low-functioning child, you have a better understanding of the frustrations that these mothers, these parents go through. And the day in and day out grind that it is just to basically just to do the basic needs and the basic tasks of life. And so if you can help with that, if you can help with their mood, if you can help with their sleep, if you can help with their behavioral issues by using a medication that improves the activation of their neurological circuitry, why not give it a try? These parents are desperate. They're grasping. They would love to have something that works. And then basically to have something that really is a synthetic vitamin, right? To be the option for them. Sure, it's a medication, they'll have to get it, but I think that they were saying too that they could get it through Medicaid, and different insurance carriers and providers would be paying for it and covering it.
Is there a natural way, like anyone who's like thinking about maybe their kid may or may not have it, or that could just help their kid? What could they get at like their natural grocery store?
Well, what you'd want to look for is methyl, methylated vitamins. So you'd want methylated B9, which is folate. I'm going to say another big word again, but it's 5-methyl tetrahydrofolate. That's essentially what you're looking for. But you're also looking for B12, which is methylcobalamin. So you have the methyl in front of those. The folate, which is the more natural bioavailable version of folic acid, which is the synthetic version. Folic acid is added to so many different cereals and different products that we consume on an everyday basis. If we don't have a sufficient supply of folate, though, if we have way too much folic acid, then it can actually become toxic for us in the body, especially an individual who maybe is already prone to ASD as a result of having one of those folate reductase SNPs.
So, as in all cases, it sounds like consulting your trusted medical care provider is the move.
Oh, 100%, yes.
I did want to touch on one last point, kind of the effect of Tylenol on the liver. Tylenol-induced liver toxicity. You wanted to talk about that.
Well, this is something people need to understand as well, because we talked about, I think we mentioned how Tylenol actually will reduce the body's ability to produce a master antioxidant called glutathione. It's what helps fight against oxidative stress in the body. So oxidative stress causes inflammation in the cardiovascular system, causes inflammation in the neurological system as well. So throughout the brain and the heart and the vessels. And we need to be able to keep oxidative stress at bay. So the body's constantly, working in and against itself, but it's also helping to mitigate some of the inflammatory factors that it itself produces. For instance, every time you exercise, you kick up oxidative stress. It's beneficial for you only insofar as your body's able to mitigate that by the production of glutathione and superoxide dismutase, which is some of these other anti-inflammatories. So if liver comes in and it stops your body's ability and you're experiencing an inflammatory reaction simultaneously, now you have a lower ability to be able to fight off inflammation, which then means that you're increasing your likelihood of having brain and neurological development issues because of inflammation, oxidative stress. Okay? There are actually 81,000 approximately cases a year of liver or Tylenol-induced liver poisoning. And the way that they treat this, generally in hospital, is by giving you either NAC, N-acetylcysteine, which is a precursor in the body to the development of glutathione, or giving you a direct glutathione push. So they'll do an IV, put it straight into your vein, and give you glutathione so that you can help your body immediately begin to detoxify and eliminate the toxic buildup that has occurred within your liver and revive you. So is Tylenol problematic? Well, I think 81,000 people a year experiencing Tylenol poisoning to their liver specifically would have to agree that Tylenol should have more caution in its use. And that's all we're hearing. And is it a possible link to autism? Well, there seems to be a correlation. Is it absolutely causative? We don't know. That means, do we have a direct connection to say, well, if I take Tylenol, I'm going to develop autism, or if I take Tylenol during pregnancy, my child will develop autism? No, we don't know that. We cannot say that. But what we can say is that those who did take Tylenol and then those who took it at higher doses tended to have a higher likelihood or incidence of developing in their child, their offspring, autism.
I just think it's so phenomenal these conversations are being had. And if you're a listener to this podcast, perhaps you're the kind of person who, instead of a pharmaceutical antibiotic, wants an herbal antibiotic from, Dr. Dummar's clinic here, or some of these herbs like Fever Clear with chills. I mean,
there we go.
These are herbs that you formulate here, Chinese medicine, and like, if this sounds better to you than a pill from Walgreens, you're in the right place. I just love that we're having a national conversation now around something that seems so acceptable, maybe not being what we thought it was.
Yeah.
Or maybe having some interesting side effects that now people are learning about.
Well, and so going back to the parent, the very first question, right? What do I need to know as a parent? Well, what you need to know is to be cautious, right? What you need to know is that the body is the healer, that the fever has a purpose. And it's okay for you to observe that, and it's okay for your child to be a little uncomfortable. And it's also important for you to know that before you reach for Tylenol or some sort of other synthetic medication, there are other options. There are other options for reducing the fever. There's other options like taking a bath, right? Like a lukewarm or even a cool bath will immediately bring that fever, that temperature down. Wrapping your child's legs in cool cloths at night if they're getting too hot, that will immediately bring the heat down from the brain into the feet, because the body has a way of wanting to balance out the heat throughout the body. So if you're concerned about brain injury, then take those steps that you can as an empowered mother, as an empowered parent, to pull that heat away from the brain, to pull it away from the head, wrapping the feet in cool cloths. Then also, if you're needing some additional assistance, there are herbals that can help internally, not just externally, but can help internally to mitigate the inflammatory process that's happening, ramp up the glutathione production within the body, and support the antioxidant effect that needs to be taking place in order to balance out some of the inflammatory process that is working so vigorously to eliminate the pathogen. Something that's really important for you to understand as well as a parent is that there have been a lot of studies that show that patients, young children and adults, who allow their fevers to run, they monitor them, but they allow them to run, actually express way more pathogenic factor in their stool than those who choose to medicate early. So if you happen to medicate, let's say you get 101, 102, and you're like, you know what, this is scaring me, I'm going to medicate, right? And then you suppress that fever, what we've found is that that child now has had its immune system tampered with. So it doesn't ramp up as much interferon. Interferon is it's an immune-related chemical that is sent out by the body that fights pathogenic invaders. And so we're suppressing that when we take Tylenol. We're suppressing the immune response. So be very, very cautious about when to implement it. Is there a time to implement it? Yes. Yes, there is. But you should observe the patient first, treat them as an individual, as we said, not as a policy. Don't just, oh my gosh, my child has a fever, it's at 101, which number do I wait for? No, observe your child. Can they communicate with you? Are they observant? Are they acting in a way, even though they might be a little bit lethargic or tired, that would be normal. But are they able to answer your questions? Does it make sense? Are they cogent? And if that is happening, even if they are just a little bit worn out and tired, and even if they seem hot, then allow that fever to run, allow the body to work. And there's no need to implement any sort of other treatment if your child is appearing in every other way to be very cogent and alert.
If folks have more questions about this, they're intrigued by what they heard here today, Dr. Ron Dummar, Community Health and Wellness in Heber City, Utah, how can they find out more?
Well, you can visit us at chwheber.com, or you can even just call us direct or text us. It might be an easier way because our phones are buzzing all the time, but 435-657-3696.
Be well now, everybody.
Namaste.
Namaste.